Hello and welcome to my channel, Living Well, Dr. Michelle with 1L. Hey, I want to talk to you about ways you can benefit yourself at home to prevent aging, to help with bone loss. So, the bones of our face are really important. And when we lose bone in our face, we get drooping of muscles and drooping of skin. So, it is one of the ways that we wrinkle and why we wrinkle is bone loss. And I think sometimes we forget, like, where do we experience bone loss, as we age? Of course, it's the jaw, it's the cheeks, and the orbital area of our eye, which actually, as we lose bone, it enlarges and then we get drooping under the eye and drooping eyelids. So we not only want to take care of the integrity of our skin, which is what holistic skincare is all about. Like number one, it takes care of the integrity of the skin by improving blood and chi energy circulation. But it also helps to relax tension in the muscles of the face, which, we use our muscles of mastication, chewing, and talking, and also our emotional expressive muscles of our face that we're constantly using. And we hold a lot of tension. So that's the second way. And the third way, like I mentioned in the beginning, is the bones of our face, which the muscles must attach to, right? So we want to take care of that. And I am going to suggest the use of a osteophonic tuning fork to help us. This is a 128 hertz tuning fork. Of course, our thumbs can work, so pressure on the points will work, and it would be a nice firm pressure if you don't have a tuning fork. So first, let me just explain a little bit about the osteophonic tuning fork. So we know sound vibration are harmonic frequencies, and our body loves to tune up to frequencies that are in tune, so to speak. So the 128 hertz is an octave below the middle C, like the piano, like the harmonic scale, right? So when you tap it, it's like a nice low hum, but the skin of your body and the bones especially vibrate. That's why it is called an osteophonic tuning fork, otto for short. And there are other otto tuning forks, but the 64 hertz is just bigger. So a little unwieldy. It's much easier and practical to use like this size, the 128 hertz. And it is generally very well received. It feels very, very good, at least to me anyway. And that has been a lot of the response that I get. It feels great. So I must give a disclaimer first before we really get into it. Of course, we don't diagnose, treat, cure, or prevent anything. Um, Always use common sense, please, when you're doing anything. And I'd like to remind you, if you see any suspect kind of lesions on your skin, go see your dermatologist. If you know that you have bone loss, that may depend on the degree, the level of how much that this would either be too strong, or talk to your doctor. That's what I'm saying. And you may have certain eye diseases that you might want to talk to your doctor about as well. So what you can do then with this video is follow along as we do it. You don't necessarily need to apply anything to your skin, just very similar to like a lymphatic facial massage. You want kind of that friction. So you don't really want to apply anything or too much to have it be too slick or greasy. But if your skin is just too dry or flaky, then you do want to apply something kind of light so it's not greasy. And then in between, if you're not using it right now, you can use certain essential oils that may benefit the bones. And I'm thinking about oils that not just benefit the bones, but also would be something you'd want to put on your face, right? So, and I make a very nice, what I call ageless face balm, and it based on a shea butter mix. And I never stick my fingers in it. I always just use a little spoon. but you could take your cream or whatever it is that you want to use, or one of my face balms, and then add a drop or two of the essential oil. And then you really want to make sure that you massage it in. So you would want to use like a helichrysum, perhaps a frankincense, maybe a lavender. So that those could, one or all three, like one or two drops of each of those could be great. This is a frankincense touch. It's already diluted, but you wouldn't be able to drop it into your cream. Other oils that benefit the bones, but I might think about more like for like your spine or your hands or your knees, would be like a lemongrass. It's also great for ligaments, Siberian fir, wintergreen. Keep in mind that wintergreen, if you're allergic to like aspirin or salicylic acid, you wouldn't want to use a wintergreen, but wintergreen really great for pain relief. And then deep blue is a blend by doTERRA that's great on our body, but I don't think I would necessarily put it on my face for this particular thing. But the frankincense, helichrysum, and lavender, ooh, wonderful, and it smells so great. So let me excuse me here, so I just want to show you first, how to, I want you to really massage, if you're using a little cream, like a smaller than a dime, and you want to warm it up, in your hand, and you really want to, massage it in nice. So I kind of go out, I always think out and up, out, and then even lifting your eyebrows. Make sure it's really, really massaged in. And that's how you will get those nice oils, penetrating and into the bones. And then you can do this particular massage that we're going to do. So I'm just going up, the neck, right? And then make sure you wipe your hands if you're using a tuning fork, because you don't want to drop it or hit yourself with the tuning fork. We don't ever want to cause any bruising or anything like that. So again, you can use your thumbs in place of the tuning fork, or your hands, like maybe hook up your fingers like this when we're doing some of the massage. So you might not be thinking, but in the beginning, oh, one other thing. On the one that I'm using, I am using a gem foot, and it really doesn't matter which kind of stone is on the end of it, but I like this better than using without it, because you can see the difference here, that it's just very small and it just doesn't feel as nice, I guess. And this does make the vibration just a little bit wider. And this particular size, so this is a 15 millimeter and this is 25 millimeter. I think it's just a little bit too big for the face and what we're doing. This is great though for body work and massage and whatnot. And and this little small one is a 6 millimeter, and this is good for pressure points, like being really particular, which that's for another part. But for this, for the osteophonic tuning fork massage, we're going to use this is what I would highly recommend. And yes, I do sell the tuning forks because I love them made in the USA. They're just a little better with, safety and manufacturing, better practices, you could say, and also holding the tone, a little more expensive than buying some that are made in other places. Okay. So we're going to start first. I'm just starting on the right occiput. So this is just where your thumb falls in just naturally. So, and the reason too is you want to make sure that your neck muscles have something nice to attach to, and a lot of tension in the neck can give us wrinkles as well, especially jowls and saggy neck. So you need to treat the back of the neck and the side of the neck, not just the front. Because if you're feeling like your neck is sagging and you have a lot of tension on this muscle, you're gonna have to also work the back, and just thinking about that muscle. So this is how I would do it. I just tap it a little bit, in the palm of my hand. I just tap that. And then I'm just going to press, and I'm pressing firm where I can really, you might be sore, but don't make it painful, right? I mean, pain where you can't stand it, but it is a firm pressure. So we're going to do it at least a couple times. It's going to naturally die down. Strike it again. And if you're just using your thumbs, I mean, you're going to want to press on each spot longer, because I mean that's what essentially sometimes why we use tools is they can be deeper and a little more effective. You know, maybe shorten your time of doing it. So you might have to stimulate, uh, you know, 30 seconds to 1 minute with acupressure. And the idea when you're doing acupressure, you know that you're done with the spot when you feel a sense of warmth or a little bit numbing kind of sensation, or you're getting, or even a relaxation. So it's kind of the same with the tuning fork. Um, and if you have any broken bones, don't put a tuning fork directly on a broken bone. You would do maybe an area near it, like if I'm just saying an example, if that was broken and you placed your tuning fork here and kind of aim it towards that area, you can feel the vibration in the body because we have bones again, and it's vibrating the bones. You can feel the sense of the vibration kind of radiating, and so in that vibration can still help the area of, if that bone was fractured or broken, but we don't put it directly on because then that would be injuring it, more instead of healing it, and also it's just way too painful. We don't do that. So next, move to the mastoid bone. So it's just behind your ear. And use your own common sense. Like if you have hypersensitive hearing, or you're wearing hearing aids, and if the tuning fork bothers you, you may not be able to put the tuning fork so close to your ear. You can always just, in this particular spot, use your thumb. And, this is a place where that muscle, that SCM muscle, sternocleidomastoid muscle, comes up. That's why it's called that. That's the name of it, mastoid. So we can help, you know, relax that muscle. So I'm doing another time on this muscle. I hope you're just following along. Um, I like to then do the other sides, those 2 points, and then we're going to do this one. This one is the first kind of dip that your thumb naturally falls in on the occiput, the base of your skull, right? Pressure is good. It's nice and firm. If you're using your thumb, you might, lean on something like this, where I'm not exerting my thumb and I'm not hurting, my hands or anything like that. I'm using the table as kind of like a fulcrum, and I'm just leaning into it a little bit, and there it goes. I can feel that, and then when I do the other point, it's like that. I should have explained that first. Sorry. And that can be kind of the same. If you're at home and you're using your tuning fork, you can use your table just kind of the same way, or use the same side. Just be comfortable. It's just for this video, I don't really have where I've got this set up a great ergonomically set, but that's okay. So whatever you do, you want to be comfortable. You don't want to hurt your hand. And you can see I'm not gripping really hard. It's a loose, and it's okay to touch this part of the tuning fork. If you only touch this, you're going to get carpal tunnel, or trigger finger, or arthritis, or hurt your hand. So you can be very, and that's another thing about these particular tuning forks, is that the stem is long enough. If the stem of the tuning fork is too short, it's really uncomfortable to do anything with them, other than just maybe hearing it or putting it over your body. But putting it placing it on the body is too uncomfortable. Oh, sorry, I digress with too much info. And now the mastoid behind the ear. Again, I could be resting my elbow on a table and just letting the weight, of my head kind of lean into the tuning fork a little bit, or your thumb. How many times can you do this a week? Well, how much time do you have? 2 to 3 times a week at least. So this is a really great thing to do in between, if you're having facial rejuvenation treatments. I would highly, recommend it. Because you can only help. And of course, it's always great to see a professional, and it's much easier for someone else to do this for you, of course. And I mean, even for me, I really prefer someone else to do the treatment. But, if you really do have a problem, you're only going to improve your results by taking this time, in between the sessions, to do the tuning fork osteopathic massage, right? So now let's do the jaw. So now I'm actually going to be kind of just up underneath the jaw, and we're just going to move it probably like, thumb width, as we're going to go across and just do a few different spots, and then we'll do the other side. So first I want to go under, and I'm not thinking about, it can be tender because of your lymph nodes. So go to your level of what you can bear, because it can be really tender on some people. Again, using that table, just a nice rest. And I'm just going, when it dies down, you can move to the next spot. But, you can spend more time with the pressure of your thumb at each spot if you don't have a tuning fork. So you can see that, as you're putting the pressure, you're also kind of tucking that skin under. So you're really giving yourself, a face lift kind of at the same time. I mean, because it might feel really nice and tight after. So I'm going to switch to the other side. And hey, if you're ambidextrous, you can use your other your other hand for the other side. This one feels, I can feel the tenderness a little bit. Just moving again, like I said, just another space, thumb width kind of space over. Or, it's really the space of the gem foot or tuning fork that you're kind of moving along here. And you might find over time that this tenderness that you might have will improve, that will decrease, along with the tightness that you feel in the muscles of your neck. You might be able to tell, like, oh, well, which side am I holding more tension in just by doing this? So lymphatic, you might have done more wiping or pumping, or circles and then pumping. So I'm just wanted to give a quick little difference, but I'm really just trying to vibrate the bone here, lower jaw. And you are helping the, what are called digastric muscles underneath, those ones that sag. Give you a double chin. So let's kind of try to go. See, it's a little hard on some of these angles for me, for myself. But anyway, you try. Just kind of look up, I guess, a little bit, and then you can get it. And when you're looking up and pressing here, you are also helping the platysma muscle. That's that thin outer muscle, like a sheet. So you are stretching, strengthening that muscle at the same time. But again, our focus is this bone right here. Let's now go to, now I'm going to be on the jaw line. Okay, so just starting just kind of in front of the ear. Again, for your own comfort level, if you have hearing aids or hypersensitive to the sound or whatever, do what you need to do. Use thumbs instead. But to me, it's not, it's nice. It's not too loud, but everybody is different. I can feel that sensation kind of going all the way up my nose. Spend the time you need. So this is really great for your jaw. Draw attention. Again, if you have face pain or, a TMJ or, this could really help you. So again, if you're not sure, you can talk to your doctor about it or your acupuncturist, which would be me. Because some sharpshooting kind of very extreme pain, maybe in the beginning, it may not benefit you to go directly on the area, of the face. You might benefit by doing either the opposite face or some other acupressure points to get that to calm down. So I'm just saying, because there's other uses besides just facial rejuvenation for doing a face massage or facial tuning fork treatments. Keeping everything, the arm and the shoulder relaxed, like on a table. Do the other side. Just right in front of the ear. Relaxes that muscle. It's really tight when we clench our teeth because we're always chewing on our thoughts and ideas. Becomes our just way of thinking to tighten our muscles in our face. First step is just become aware of it, that you're doing it. Because if you're clenching at night, you're doing it. Even if you say you're not, you're doing it. You're clenching and tightening throughout the day and when you're just thinking. So just become aware and then, release, let it go. Bring your thought and your breath to the area of tightness and breathe into it. Let it go, let it relax. If it feels a little nervy when you do this, just kind of move off of it a little bit. Maybe you caught a nerve because you do have a nerve that comes around right here and you don't want to pinch a nerve. So if it feels too painful, sharp, or kind of nervy, just move, off of it or something a little bit. Okay. Or kind of wiggle it a little bit, move away from that area. It does come down this way. Nerve, facial nerve. Isn't this fun? If you're doing it along with me, it's quite nice because you're getting all these lovely benefits of massage, tuning fork, the pressure, right? On the jaw. Reminding you to spend the time you need at each spot. If you need to take longer, you need to take 30 seconds to a minute. You might even feel different, like little bubbliness on the end of it. It's just something, is moving within the tissue. just some tightness or something. It's okay. And then right here, it's kind of like the dimple. Now let's do this spot. The mentalis. We're going right in the center. This is a acupuncture point, Ren 24. The last one of this channel that, well, it doesn't go up higher than this, just ends here from our perineum. From the perineum up the center line all the way to here. Just going right next to that line. Do you feel tightness or anything kind of going down into the chest when you press on this point? Hey, I don't know. Say so in the comments. Let me know. And I didn't mention to, hey, please like this video and subscribe so that, I know that I'm helping you. So whatever we're doing here is beneficial to you. And now I'm just kind of taking it, like here's the corner of your eye. Well, it should be straight on here so you can see that. And I'm just going down right here because we're getting more into the TMJ, the little more into the jaw. Just pressing. And then go under, I'm kind of going under the jaw bone because we do lose a bone. And we can get arthritis in this joint, this TMJ joint. Don't cause more trouble, if you really do have an issue here, if it feels out of socket, or maybe you don't want to press too hard. Like I said, I don't know everything that's going on with you, so you need to use your common sense on that. And then above, so this is, zygomatic bone and comes right across there. I'm going right underneath, kind of in level with my pupil of my eye, and kind of going underneath that cheekbone, the zygomatic bone, pressing up a little bit. Tender spot sometimes. I'm on the upper lip on the right. So where did we leave off? We did this side, this part. So we were here, this side. It's just sometimes easier to do them back and forth or one side, the other side. So I was just next to that. Going again, right. I'm kind of more in the front, but underneath it, level with the end of the eye. So we're getting into the TMJ joint on the left. Press it nice, and then go under the jaw. There's the bone right there, goes across. It's a place that can be sore. Again, if your joint is out or clicks, or you don't want to cause a dislocation by, doing it, you could always go a little bit out to just feel the vibration, or maybe up here if you have an issue here. I don't want you to cause a problem when we're trying to solve a problem. We're trying to solve the bone and joint loss problem or tightness, and Sometimes directly on is great, and sometimes we have to go adjacent to the area. And if you're not sure, you can ask a professional. Don't want to cause a problem. But you are responsible for your own health. I always try to remind people it really is, um, you are responsible for your own health, and that's why you're here. Because really, facial rejuvenation and looking good and anti-aging, it's way more than just wanting to be beautiful, is what I believe. So now, one more. Did I do this one? Yeah, top of this side, because we don't want to forget this bone. You know, we're focusing on all the bones of the face, most of the bones of the face, anyway. And help your teeth, right? Teeth are bones, living tissue, by the way. So let's go. When we are going to go under this part of your eye, you're going to probably look up, and you're not going to squish your eyeball. You're not going to press on your eye, and you don't want to pull this little nice thin tissue down either. So this could be done more gently, and maybe we could start at kind of the corner of the eye and nose. Sorry, I'm going to bring us down again to do large intestine 20, fragrant splendor, right? Because we should be able to smell everything. And I'm kind of pressing maybe up and out a little bit on this point. Didn't want to forget that one. And so now when I do this, you can look up and just, I'm gently touching kind of the rim of my eye, but I'm not pulling down. I'm just touching, and the pressure is not very much, because I'm just on the rim of that eye socket. You don't have to do much here, because you can feel the vibration and you can feel a little light pressure. You don't want to injure the eye or the eye socket, so you don't like press with all your might or anything like that on this part of your eyeball. Don't squish your eye. But it's kind of cool. I can kind of feel the vibration almost like air a little bit going to the outer socket. So before we go around the eye, I like to do, this is a acupressure point Taiyang. It's right on the temple. So it's that flat kind of, you get a little hole right there. And you know what? We lose bone here, and we get crow's feet, and we get drooping eyelid and lines and whatnot because of this. And you can even take it a little out and go above the ear. And then we're going to now go under. We're going to lift, and I'm in the corner of my eye, and I'm pressing, but I'm not pushing into my eyeball. So it's just right here. This is urinary bladder 1 on the meridian, and it can be tender. I'm just pressing it right there. Not even very much pressure, and I feel soreness. So that's plenty, because again, I know I'm harping on the don't injure yourself here. And then just move it another, I'm right on that. See, you can even give yourself a little lift as you're doing it with your fingers. You can see where I'm at on my eye. It's kind of like the edge of that rim. Right there. And the eyeball is totally, I'm not pressing it out of the way, any such thing like that. Then we can do the edge. We just don't want to miss, a spot. And then let's just go now, really right here. This is, I'm trying to kind of lift up, and you can use your fingers to kind of help the opposite. And it can be sore, right on the edge, inner edge of the eyebrow, bladder 2. And, and then here's where you can tell that when you really don't want it to be too slippery, when you want to be able to get that lift. So, that's why I was suggesting that, you can put the cream on after, or just use it if your skin is really flaky and super dry. Your skin will just absorb it right up anyway. But like this, you get more lift, if it has a little traction to it, like a little bit with this particular part. So you don't want to slip, and you want to be able to lift. It kind of is sore, but it kind of feels good. Now I'm just at the end of my, I think we'll just go ahead and do the rest of this side. So I'm just going on my forehead, just above on this ridge. Take your time, use as many, 30 seconds to a minute. Depends on how much time you have, right? Hey, if you're following along right now, great. Because this is making you do it, right? If you don't follow along, you probably won't finish it. I'm just saying. And then I just go up to the corner of my head. All right. So we're seeing a little more lift on that eye compared to the other eye. So don't think we did this one on this side, the large intestine 20. Inner corner, just kind of right there. You know what? This helps your sinuses too, because often when we get mucus and things stuck in our sinuses, it's hard to move out, right? So again, just gently on the rim. I might want to look up a little bit. Just hitting it on my knee in case you're wondering. It's just crazy how you can feel the vibration like kind of differently between side to side. Like you feel it down, all the way down into your chest on one side. Do you feel it in the back of your head even? Do you feel it down your neck? Oh, just make a note of it. So now the kind of the corner. Let's do that Tai Yang, the temple point. So great for headaches too, because releasing tension in your neck and face and head and scalp, but the mid back too. I am pointing that out, that sometimes our headaches and migraines and neck pain come from the mid back. So that's what's great about, having acupuncture and tuning fork massage and facial massage, sculpting massage can help release all that tension, which is really getting to the source. I mean, most root pain problems is tension. It's the tension that we have in our muscles, because, and as we have tension, decreases the oxygen, in the blood flow. And then we also don't get nutrients, we don't get oxygen, and we also aren't removing waste products. So let's go kind of that inner corner, that bladder 1. Just, rest yourself. Oh, we're almost done. Move again to just another spot. Oh yeah. Make sure you can lift that eyebrow as you're doing this. You might as well, right? just kind of on the edge. Feels good. Press too hard. Don't break any bone or anything like that when you're here. Now I'm pressing up onto the bladder tooth. Up. Oh, awesome, right? I mean, maybe you've heard about all those vibrating um, devices that you could buy for your bones. I mean, it's kind of getting more and more common. People always ask me, should I get that mat? Like you can have a mat that you can buy, like your body lays on it, or one for your feet, or um, why not? A little vibration can help the bones. That's why kind of like stamping your feet and different things like that. Or sometimes you can't stamp your feet. You can't even, because maybe you have bone loss that's too advanced. Anything could break a bone at certain levels of osteoporosis. So you need to be careful. But, when they say weight bearing, that they really do mean weight bearing. Doesn't mean weightlifting. Though weightlifting is great exercise and is good for your muscles, and having good strong muscles is good for your bones. But that's weight bearing is landing, right? It's getting that feet off the ground, or pressure vibrating. That's what stimulates cartilage, and that's what stimulates bone. So maybe if you're standing, you can only just gently kind of vibrate your knees together. You might not be able to jump because it's just too late. Things are too far gone, and you'll break a femur or something like that, or a hip. And that's where maybe some of those mats and things like that. I haven't tried one myself, but people ask, and like, well, if it's affordable enough, or getting the osteophonic tuning fork treatments, and having this, doing it on your face, certainly feels wonderful too. But we never promise anything. I mean, nothing unfortunately, there really isn't anything like 100% like guaranteed. So I never like to say 100% guaranteed, but we just do for ourselves whatever we can, every day. Many different levels of our own holistic health care that we can do. So, and just kind of end with just some nice, maybe even just a little pinching, which is also helps to stimulate the what? What do we want to stimulate always, all the time? Elastin and collagen. But this video isn't about that. But we're just ending with just some light. And that's it. So I hope you enjoyed. Be sure to like and subscribe. Talk to you soon.